Welcome to our EquiAid certification class. This is an online program that will teach you about emergency first aid and handling in horses. Throughout this program, you'll have various presentations that you will need to watch, as well as some quizzes and a final exam at the end. Individuals need to achieve an 80% or higher for the course in order to receive their certification and certification cards and certificates. If you have any questions throughout this course, please feel free to contact us at info.petemergency@gmail.com. Let's go ahead and get started. First aid for horses is obviously very important. If you're a horse owner or barn manager, you need to know some of these vital skills and techniques in order to make sure that you can prevent medical emergencies from happening, or if one does happen, that you'll have the ability and the knowledge to be able to manage that emergency in the hopes that you can have a better outcome for the horse, keep the horse's condition from getting worse until a veterinarian arrives. Now, horses are very different than dogs and cats. Horses, being very large in nature and their body and size, can cause quite a bit more damage to themselves and also to the people who are trying to care for them. The number one rule of thumb when you start working with horses is to keep yourself safe. We're going to go through some restraint techniques, some safe transporting techniques, and talk about some other information that would be necessary to know in order to keep yourself and other assistants safe when you're trying to work with a sick or injured animal. Now, first aid for horses is generally broken down into two categories. Number one, it's medical aid, something that you are doing that does not require veterinary intervention to help the horse in some type of medical injury situation. The second category is a temporary measure until veterinary care can be ascertained. So it might be something such as stopping the bleeding or keeping a horse calm or applying some type of first aid medication, bandage, things like that, until a veterinarian can arrive. This type of first aid is not intended to fix the horse, but is intended to keep the animal from having their condition get worse or hopefully keep them alive until veterinarians can arrive. Now, with horses, as opposed to other small animals, we have the challenge of their size in the means of transportation. Most large animal veterinarians that do care for horses have a mobile unit where they can come to the farm to treat or work with the animal. Small animals such as dogs and cats, we can easily put them in a vehicle and transport them to a veterinary hospital. Now, there are inpatient large animal clinics all over the country where you would need to bring your animal to the clinic, but usually you're bringing them to the clinic because you are looking for a much larger invasive service such as surgery or advanced diagnostics such as CAT scans and things like that that can't be done on the farm. But most veterinary procedures, minor surgeries as well as x-rays, can be done on the owner's property or a boarding facility's property. And so that's why first aid is important for horse owners and barn managers, because there's going to be a gap in time from when the veterinarian is traveling to your barn that you will need to tend to and provide medical care for your animals. And that's what we're here for, is to help teach you some of those basic first aid skills so you'll be prepared. Again, you want to try and keep the animals calm the best that you can. Horses are prey animals, so they have different behaviors and mentalities as compared to dogs and cats, who are predatory species. Their fight or flight response can be much more dramatic, where they can trample people, kick people in their panic to get away. Also, if they're in pain, they're going to react potentially in a more dangerous manner because of their size. So act calm, keep your voice down, don't panic yourself. It will certainly make the animals feed off of that, and they will sense that, as well as anyone around you. It's best if you're trying to keep the environment and the situation calm. It will help keep everyone around you working with you as calm as well. Try to pay attention to the horse's attitude. Do they seem anxious? Do they seem very stressed? Do they seem like they're not bothered at all? Are they very lethargic and barely moving? There's a lot of different things that you can observe in the animal's environment to kind of tip you off if there is a abnormal situation. Most horse owners know their horses very well, particularly ones that see their animals very frequently, ride them frequently, work with them frequently. If their animals on their own property and they're caring for them day to day, they're going to be able to recognize problems right away. If your horse just isn't doing quite right, isn't acting normal, maybe normally they come right up to the barn in the morning to greet you when you come out to feed. In this particular day they don't, and they're in the back of their stall or in the back of the pasture, then that can be a good cue that something is wrong or something is off. So get to know your horse's attitude, behavior, its normal routine. Horses being herd animals and the way their behavior works, their instincts are very routine. They do very similar things every day, almost clockwork to the same time every day. So that will make it easier for you to detect early on if there is potentially a problem. Moving horses that are sick or injured to a quiet surroundings, familiar surroundings will help the situation, at least keep them from mentally getting worse. So it's always a good idea to, if you have an animal that's out in a pasture and that you notice is sick or became injured, carefully try and walk that animal into their stall or their barn or somewhere that's familiar to them so it doesn't add to the stress. I'm going to show you today how to assess the injury or the illness. We're going to talk about how you can better restrain animals to work on them in a medical situation, which is different from restraining them to say saddle them to ride them. In other modules and sections of this course, we're going to talk about common medical emergencies and what type of first aid you can administer and you can do during that emergency. We're going to talk about different options on how to manage this emergency and especially how to recognize. In the triage module, we're going to go through how you determine if the animal has a medical emergency. Is it life-threatening? Can it wait a little while? Does the veterinarian need to be called? Things like that. When in doubt with large animals, I always recommend people to seek veterinary advice. If you're not sure, what type of first aid that you should administer or if it's serious or not, definitely contact your veterinarian. It's always best to run things by them when something goes wrong with your horse or the horses in your care if you manage a barn or a stable, so that you protect yourself if it potentially might be worse and you're not providing the appropriate amount of care or the correct care. Definitely know that your veterinarian is there for a reason and they're there to counsel in any way. So when do you call your vet? Well, there's a couple different levels when we talk about emergencies. There's the critical level, and this is the most urgent and most worrisome. This is when you need to call your vet immediately, and this potentially could be a situation where you need to trailer your horse to an inpatient facility, so that will need to be discussed and determined as well. These are conditions that can be life-threatening. Potentially the animal might be in a situation where they're going to be difficult to move, where you need help and maybe trying to get them in a trailer to get them where they need to go, or at least bring them to a safe location until your vet gets there. These are here on the page is just a list of some common emergencies that we would consider critical. Non-weight bearing, a lameness, that's when they won't put their legs down, they won't put pressure on them, inability to breathe, severe bleeding, colicking, which we're going to talk about a lot of these when we get to the first aid section, blindness, eye trauma, any type of trauma that potentially could hurt vital structures such as the brain and the blood and the cardiovascular system. And of course, a very high fever or heat stroke, which we're also going to talk about in some of the sections. We're going to go through how to take the temperature, what normal temperature should look like, and we'll talk about hypothermia, which is heat stroke as well. Then we have our urgent category, and this is you need to call the vet the same day or at the very longest the next day. These are things that can be observed as long as you're around and can watch the horse and keep an eye on them for a period of time and see if it gets worse. Things like low-grade fever, weight-bearing lameness, but that has just, you noticed just today. Um, some superficial trauma, like towards, things that aren't very deep in the core of the body. Less severe colic that's showing some minor signs of colic, not necessarily the latter, more severe stages of colic. Um, Laminitis flare-ups, respiratory issues such as inflammatory respiratory disease, RAO, originally called HEAVES, so things like that. Then we have our elective and our preventative visits with the vet. Elective is when you request the visit for the vet to come out. They're things that are less serious, non-life threatening, so slight lameness, maybe some irritating skin problems, but are not causing any severe symptoms, minor eye discharge, but there's no pain or vision loss, reduced appetite, difficulty chewing, and nasal discharge, things like that. And then preventative visits are normal, healthy animals that are you're asking them to come in to do vaccinations, maybe to float the teeth, do some general wellness exams, things that aren't going to be emergent in any way. So what do you need to know? Well, you need to know the difference between normal horses and horse behavior and abnormalities when they arise. Just like we talked about a few minutes ago. If you know the routines of your horse or the horses in your care, you know what they normally do on a day-to-day basis, whether their eating habits, all those different aspects, and then you see a change in that, that's a way you can determine that potentially something bad is starting to go on. Be observative. Make sure that you can recognize body conditioning score in horses. What does a normal body condition look like? What does an overweight horse look like? What does an underweight horse look like? So you can determine changes in body condition, knowing how to do a basic physical exam, how to take vital signs. These are things we're going to go over in this program, so that by the time that you've completed and successfully passed this program, you'll feel very comfortable that you can do. Look, what can you do hands-on, hands-off? There's a hands-off observations when you're looking at horses, going through their general mentation. Do they seem like they're staggering? Are they acting normal? Does their vision seem, when they walk around the paddock or the stall, do things seem normal? And then prevention is the best way to quote unquote treat a medical emergency. If you can prevent it in the first place, and we say this in all of our classes, prevention is the key. A lot of injuries can be prevented. A lot of emergencies can be prevented. So it's important that you also can look at the environment the horse is housed in and make sure that that is safe, and other people working with the horses know safety behaviors and know how to close gates and know how to interact with the horse when there are other horses present. Those are just some examples of some things that you want to do to try and prevent these problems. And we're going to talk about how, to do safety checks in your barns and what are some safe aspects when it comes to trailering. And we'll give you some of that information as well to really help you in the preparing and the housing for the animals, the way the animals are being handled to prevent medical emergencies. So what are some other indications that something might be wrong? Well, certainly if the animal's not eating normally, they have a decreased appetite, they seem more lethargic. I'm not saying all of these symptoms are happening at once. It might be only one or two of these symptoms, and then something's just not quite right here. So decreased appetite, lethargy, which means they're kind of mopey and maybe they're laying down a lot, they don't want to get up. They maybe lay down longer than normal. Maybe you notice in the afternoon they tend to be laying down for a period of time every day, and they didn't used to do that. Horses are herd animals and they want to be together with other horses. And so if you see a horse that's now singling itself off by itself, in the pasture, it's not interacting with other horses like it used to, that's a sign that there might be a problem. Sudden lameness is always a key indicator of a problem. Gum color. So if you lift up their upper lip and you look at their gums above their teeth, and they should be pink, like a pale pink color. That's normal. If you see any other color like blue or purple or even fiery red gums like the font on this page, that's a key indicator that there's a problem, that there's something wrong. There's a variety of different abnormalities that relate to abnormal gum color. Are they squinting, tearing? Are they holding their eyes closed? And of course, any fever that's greater than 102 degrees is cause for concern. Horses are out in the elements, they live outside in barns and pastures, and they're prone to getting infections from things. So we're going to go over in the program how to take vital signs, how to take a temperature, and it's something you should do regularly on your horses anyway. Any horse in your care, you should take a normal temperature and just make sure things are staying around the same level. That's a good, helpful way to manage that. So I already mentioned how important human safety is. Also understanding animal behavior. Throughout this program and this course, there's going to be a variety of videos that you need to watch in order to gain more detailed information about what we're talking about. And one example is the horse behavior video. Watch the video. Learn how to read horses' body language. The video will show you different horses with different stages of body language and what that means, so that you can recognize aggressive behavior and submissive behavior. And horses have specific body languages if they feel sick and they don't feel well. We also want to go through, how are these emergency skills different from small animals? Is some people with a lot of small animal dog cat experience, need to learn how to transist over to horses and cattle and larger species, because the way we handle them is different. The way that they feel sick, may appear to be different. And just knowing what to do. Our company is, the foundation of our mission is to help people help their pets. We want to give you the skills and the knowledge necessary so when if a medical emergency arises, you know what to do, and you can hopefully give that animal the best chance of a better outcome. So I talked about how trailering might be something that has to be done with a large animal if it needs to go to an inpatient hospital. More severe conditions and injuries may need to go to an inpatient hospital in order to get the appropriate treatment, such as surgery and other more involved diagnostic measures. It's a terrible idea to wait until an animal is injured to try and introduce them to a trailer. This is a very scary, noisy, intimidating object that you're asking this horse to walk into. And so I firmly believe that every horse, even if you don't take the horse off the property very much, you don't go to horse shows, you only ride your horse around your home, those horses still need to be comfortable in a trailer. If you don't own a trailer, find someone that's in your local community, maybe at a local 4-H group that has a trailer, that can come and do some trailering lessons with your horse. And that way the animal is comfortable getting into the trailer. So if the time ever comes that you need to get them into a trailer to get them safely somewhere, they will not be as resistant to it. Horses tend to be more familiar when we look at all the livestock species. If you're familiar with cattle and other food animals, they're not as familiar with trailers as horses are, because people who own horses or work with horses tend to trailer places. They trailer to horse shows, to rodeos, maybe to places to trail ride. So there's a lot of different comfort levels that horses have with trailers. But in general, the rule of thumb is, in order to trailer as safe as possible, to make sure that animal is familiar as possible with them. Now, a variety of different injuries and situations might determine different ways that you would tie a horse in a trailer. For example, a lot of respiratory emergencies, the veterinarian might tell you not to tie the horse in the trailer, to leave their head loose, so that you don't inhibit any more, of that difficulty breathing situation. Some will, require wrapping of legs, and some might not. I mean, it really just depends on the scenario. So definitely, when you contact your veterinarian and ask them, is there anything special that I need to do when trailering this horse? Trailers need to be inspected for safety, again, long before the horse has to get in it. So always check for sharp edges. Make sure the floor is solid. You don't see any soft spots in the floor. The mats are not pulling up. There's a lot of different trailers out there, and every trailer is different. There's straight load trailers, there's side load trailers, there's windows, and some don't have windows. So just safety and inspect your trailer fairly often. Trailers that sit for a long period of time and aren't used tend to develop, sometimes develop rust or develop weak spots in where screws and bolts hold pieces of the trailer together. The floor can get rotted. So again, my tip here is just make sure your trailers are safe, or whomever's trailer you're using is regularly inspected for any type of safety issues and kept in good repair. So identifying your animal can be something that can be as easy as putting in a microchip. You put in a microchip once, and then that microchip is there for the life of the animal. And microchips are a little device. It's about the size of a piece of rice, and it's encoded with a number that's registered to you and your contact information. So microchip your horse. Every animal shelter, rescue, first responders, police and fire have access to a wand, which is a device that when you wave it over an animal and it has a microchip, the wand will detect the number and it will read out on the screen. And that way, if your horse is ever separated from you, gets loose, stolen, God forbid, or things like in the Hurricane Katrina disaster, animals were missing from their owners, and they had a terrible time trying to match horses up with their owners. People couldn't find their horses. Horses were taken to different states for housing because they didn't, they had all this excess of animals that they didn't know what to do with, and it was a disaster. So I'm a very big proponent for microchipping, but there's also options such as tattooing. You can take multiple photographs of the animals to show any key markings or body structures that might identify the animal and keep those in your possession. So if your horse ever does get missing, you can identify them. Freeze brand markings that relate to the ranch or the owner, something that could be done as well. And I know in some states they require a freeze marking of the for ownership, and so whatever your state identifies is great. And if a horse is going to an inpatient hospital or being trailered somewhere else or kept somewhere else, that permanent identification is really key to being able to ensure safety of the horses as it relates to getting the horses back to you or you being identified as the owner. And some other ways to identify horses that you can do is you can paint hooves and use crayons and clip phone numbers into their hair. And this is just if you're ever going to be separated from your horses and there potentially is a disaster or an emergency, you have a way to reunite yourself with your horses. So this is just some other ideas. ID tags on the halters. I know I've been at some farms that have neck halters on broodmares and they have an ID tag, so it's whatever management aspect you might use. All right, so let's discuss a little bit about restraint and handling. So again, there's a variety of videos in this course that will show you different restraint and handling techniques. And even if you are a very expert horse owner and you've worked with horses all your life, you might really learn something new from some of these videos. I mean, I've worked with horses all my life. I've raised horses, I trained horses. And sometimes when I watch various training videos, even if it's a simple video like haltering and leading, I might find a new tip that might improve the way that I'm doing it, something better, maybe a different even type of halter that I didn't know existed. So definitely watch all the videos, learn from them, and be able to use them if the time comes where you need to manage those type of situations. So injuries from horses can range from, when they panic and they get stressed, some, that fight or flight instinct kicks in. Fight means that they might become aggressive, they might kick, strike, bite, and then the flight instinct is, their brain just tells them run away, run as far away from this stressful situation as possible. So they can drag people, trample people, break doors and fences and stall doors and hurt themselves. So be aware of the different type of bad things, things that could happen from a horse that you're handling in a emergency situation. Emergencies in general are going to make horses more reactive. So they're going to react to the pain, they're going to react to the panic, to the anxiety, and to the change environment, and the terrible way they might feel, or if they feel sick. So I mentioned earlier that horses are prey animals. They have the fight or flight instinct. They are herd animals. They look to stick together. They feel like it's safety in numbers. In the wild horses have, this is where this behavior developed from, is from wild horses. And, these are horses that in their brain, they know that if they are the slow one or the weak one, they're going to become eaten by the mountain lion. So their brain kicks in these survival mechanisms that the animal uses to protect themselves. So running away from a threat, staying together in a group, because there is that strength in numbers. So always look at your animal's perspective, and think of it like a wild horse. Think of it like, and I know the horses you work with or potentially work with are not wild, or maybe they are. Maybe they're BLM wild Mustangs and you're raising them. That's awesome. I love that program. But maybe, whatever your horse is, they all have that deep, survival mechanism embedded in their brains. And so they may look at this emergency situation as like the mountain lion, and they may react accordingly. So be familiar with horse behavior, watch those videos, know that horses are going to try to take the easy way, quick way out of a situation, and recognize body language so you can better prepare how you're going to manage the situation. Have the appropriate restraint equipment on hand. Certainly every horse should have a halter and a lead that belongs to that horse, or that can be used on that horse, that's sized appropriately. A lot of farms do not leave halters and leads on horses. Halters, not leads. Leads are, kind of like leashes on dogs. They use them to lead the animal around. But a lot of farms have halters that are identified and tagged to the horse it belongs to. But when they turn the horse out in a pasture, or they bring a horse into the stall at night, they take the halter off for safety reasons, which is a really good idea. Leaving horses with halters on can be very dangerous. They can get them hooked on something. They can get them hooked on a fence or a tree, or, they play with them with each other and then they get wrapped in them. So there's various different pros and cons to leaving halters on horses. But, you need to have a halter available. So if you have an emergency, you need to get the horse out of the field. You need to get the horse out of the stall. You need to get the horse on the trailer. You need to have a halter that you can get on that horse. And we have a great video that shows how to halter horses, and how to safely move them and how to size them appropriately. You might want to have a towel or blanket on hand, a small one, so that you can cover their eyes. When you cover a horse's eyes, it's not that they're going to not react to a situation, but their reaction is delayed or dampened because they can't see. So a lot of people that train horses, difficult horses to get on trailers, might use a sweatshirt or a towel or something, the face cloth, to put over their eyes. You tuck it under the halter, and then the horse will then lead, following you as the herd leader, where it needs to go. So that's also something that can be used. Having ropes, if you need to use them to guide behind their rear ends to help guide them forward. And then shanks and twitches, which we go over in the manual. The ebook manual is available for download here in the course, and that's our textbook that goes with this course. So make sure you download that, and you have that to reference and read through as you go through the program as well. And that will go through how to, put on a shank, how to put on a twitch, and why those restraint devices are necessary, and we have videos for that as well. So I told you earlier that we were going to do a barn safety check, and this is just kind of a tool and a checklist to go through and look at things that can prevent a medical emergency. So, make sure entranceways are clear, that doors are fully opened, like stall doors or gates, before you walk through them. Make sure you double check everywhere in your property that you do not have poisonous plants or poisonous materials around where the horses can graze and eat them. In our textbook manual, we have a list of all the different poisonous plants, shrubs, and trees that can be toxic to horses. So take a look at that and match it up. Look through your property and make sure you do not have any of that growing on the property. Aisles in the barn should be clear. The ceiling should be high enough so animals don't rear up and hurt themselves and hit their head. Make sure the floor has some type of good traction on it, such as if it gets wet, it's not slippery. We don't like, that could be a problem. Make sure walls and doors and things are free of clutter. Make sure if you manage or own a boarding stable that your boarders aren't leaving their tack and their supplies in the middle of the aisles or even off to the side of the aisles. You want to make that as clear as possible so horses don't get hung up or trip on anything, or people don't trip on anything when they are working with a fractious horse. Make sure that your lights are covered. The horses can rear up and smash into a light bulb and potentially be cut by the glass. The glass falls in the stall. They can get glass in their eyes, glass in their hooves, and their frog, and the sole of their feet. And they potentially can get electrocuted. Even one small light bulb in their stall you wouldn't think could electrocute a horse, but it definitely can. So make sure that they're covered with some type of caging device so they can't smash through the light bulbs. Check for wasp and hornets' nests in the barns. If a horse gets stung, they could have an allergic reaction. If they get stung by enough hornets or wasps, they can have a very severe reaction even if they're not allergic to them. So that's just some things that you can do to look through the environment, the entranceways, and the aisles. All right, let's talk about stalls now. So stalls need to have wide enough doors. The latches should be flush with the door frame. You don't want any part of the latches protruding or sticking out. Examine boards along the walls for rot, loose nails, spots where they may have chewed on them. Make sure you keep that in good repair. Floors should promote drainage, so you're not having a buildup of urine and bacteria in the stalls. Have good flooring that the animals can stand on for a length of time. The bars and the windows should not be glass that can be shattered. They need to be, again, the bars if they get rusty, they can fracture and crack and bend, so you want to make sure you keep that in good repair, as well as any windows should be plexiglass or just solid wood or no windows at all. Obviously, windows are good because for ventilation, so it depends on your barn, what the aisle looks like, how high the ceilings are. Do you store hay above the stall? Things like that will be a huge factor in how you safety-proof your barn. And make sure that if you have a cast rail around the bottom so horses can't get cast, which is when they go down on the floor and they can't up against a wall and they can't flip back over and get themselves up, they get stuck. So there's a good video on watching that you need to watch about how to handle a cast situation. If a horse is cast, what do you do? Look outside the barn, walk your property. Your fences should be in good repair. Replace any broken boards. Repair things immediately. I mean, not only is this a physical hazard to horses where they could get scratched, lacerated, they could puncture part of their body on the fence, but they could also get loose and then get hurt in some other fashion. So definitely check your fences frequently. Remove any fallen branches or tree stumps. If there's anything they're chewing on, try to prevent them from chewing on fence posts and objects and trees where they could choke. They could get things impaled in their mouth and their face. So look around. And again, the poisonous items, make sure you don't have any poisonous plants, anything like that, where the horses could graze and eat them.